In this video, I'm going to discuss about the attachments of the mandible. So first of all, this is the body. So this is the external surface of the body, and here you can see this is the oblique line. So on the oblique line, there are attachments of three muscles. Posteriorly here, where we have the molar tooth, just here we have the attachment of the buccinator muscle. Then here we have the attachment of depressor labii inferioris, then depressor anguli oris. Okay, and here here we have the incisor tooth, and just below this depression is known as the incisive fossa, where we have attachment of incisivus and orbicularis oris muscle. Okay, now on the ramus, this on the lateral surface, there is attachment of masseter muscle. This masseter muscle is not attached on the entire lateral surface, but on the posterior superior aspect. This ramus on the lateral surface of the ramus is related to the parotid gland. Anteriorly, we have the masseter muscle. Then on the inner surface, here you can see there is a rough area on the medial surface of the ramus, and in this rough area there is attachment of medial pterygoid muscle, which is a muscle of mastication. And this is the mandibular foramen, from where passes the inferior alveolar nerves and vessel. Here you can see this is the mandibular foramen, where I am passing my pen. So this is the mandibular foramen. From this foramen passes the inferior alveolar nerves and vessels. Inferior alveolar nerve is a branch of mandibular nerve. This tongue-shaped projection is known as lingula, and on this lingula there is attachment of sphenomandibular ligament. One end of this sphenomandibular ligament is attached here on the lingula, and the other end is attached in the skull on the spine of sphenoid bone. Then just here, just posterior to the third molar, on this region there is attachment of the superior constrictor muscle of pharynx, and just posteriorly again there is a ligament here which is known as, there is a raphe attached here which is known as pterygomandibular raphe. One end of this raphe is attached here, and the other end of the pterygomandibular raphe is attached on the pterygoid hamulus of the pterygoid plates, which is present in the skull. Okay. Now there are the two processes. This is the coronoid process and this is the condyloid process or the condylar process. The coronoid process here, it gives attachment to another muscle, that is temporalis muscle on the anterior border, and on the medial surface this temporalis muscle is attached. And this is the condylar process. This is the head of the mandible. It articulates with the mandibular fossa to form the temporomandibular joint. The constricted part just below this head is known as the neck of the mandible. So the neck of the mandible, laterally it is related to the lateral ligament of the temporomandibular joint, and medially it is related to the auriculotemporal nerve and vessels. The auriculotemporal nerve is again a branch of the mandibular nerve, and here anteriorly you can see there is a depressed area. This is known as the pterygoid fovea, and on this pterygoid fovea there is attachment of lateral pterygoid muscle, which is again a muscle of mastication. So we have discussed all the muscle attachment on the ramus. Here lateral, on the lateral surface there is attachment of the masseter. Medially we have the attachment of the medial pterygoid muscle. On the pterygoid fovea there is attachment of the lateral pterygoid muscle, and on the coronoid process there is attachment of temporalis muscle. Okay, now there is a foramen here which is known as the mental foramen. Through this mental foramen passes the mental nerves and vessels. Okay. So these are the structures that are attached on the mandible. This masseteric notch or the mandibular notch is related to the masseteric nerves and vessels. Masseteric nerve is again a branch of the mandibular nerve, and the masseteric vessel, the artery, is a branch of the maxillary artery. Okay, now just here, this region, this is the mylohyoid groove. The mylohyoid groove is related to the mylohyoid nerves and vessels, and just anterior to this lingula here, this area is related to the lingual nerve. This area is related to the lingual nerve, and this fossa, the submandibular fossa, lodges the submandibular gland and the facial artery and the submandibular lymph nodes. The sublingual fossa lodges the sublingual salivary gland. Okay, so submandibular fossa is related to the submandibular gland and the facial artery and the submandibular lymph node. Here we have the submandibular. Here we have the sublingual gland, salivary gland. Sublingual fossa is related to the sublingual salivary gland. On the genial tubercle, on the superior genial tubercle, there is attachment of genioglossus muscle. On the inferior genial tubercle, there is attachment of geniohyoid. On the digastric fossa, there is attachment of the anterior belly of the digastric muscle. So this much is there in the attachments of mandible. That's all. Thank you.